Good afternoon, students. So, welcome to our new session. So, today we are going to discuss certain disorders in amino acid metabolism, also the synthesis of 5-HT, melandoin, and biosynthesis of catecholamines, heme, and finally hyperbilirubinemia. First one is tyrosinemia type 2. So this disorder we can also called Richner-Hansard syndrome. This disorder is mainly due to the enzyme tyrosine transaminase. Main cause of this disorder is they will causes a degradative pathway of tyrosine. Also the tyrosine derivatives accumulation and excretion also takes places, namely para-hydroxy phenyl pyruvate, para-hydroxyphenyl acetate, lactate, etc. Mainly this disorder is characterized by skin, that is dermatitis, eye lesions, and mental retardation, etc. The neonatal tyrosinemia. This is mainly due to the enzyme para-hydroxyphenyl pyruvate dioxygenase. And this is a temporary condition. They will usually respond to ascorbic acid only. So by the inhibition of this enzyme, that can be overcome by the presence of this ascorbic acid. Next is alkapturia, that is black urine diseases. Mainly this disease is caused in inborn errors due to the enzyme homogenetitis oxidase in tyrosine metabolism. So this enzyme will accumulates in our tissues, blood, and they are excreted through our urine. And on stanting, this enzyme will get oxidized to quinones and they polymerize to give black or brown color. So for this reason, the urine of these patients will be cock in color. Then biochemical manifestations. So this enzyme will get oxidized by polyphenol oxidase and they will give rise to benzoquinone acetate. And this will again undergo polymerization to produce a pigment named alkaptone. So this alkaptone will deposit in our connective tissue, bonds and other organs, etc. So this conditions, deposition, we can call it ochronosis. And what is the diagnosis? If there is any change in the color, we can say that it is due to this alkaptonuria. And there are so many tests, ferric chlorate and silver nitrate tests. This is mainly due to the reducing agent of the homogenetize, and we can also perform Benedict's test. Then treatment. There is no proper treatment is found. We have to take the protein diet very less. Then tyrosinemia type 1. We discussed type 2, now it is type 1. Type 1 is mainly due to diseases. It is fumarate lactoacetate hydrolase or malate lactoacetate isomerase. So what are the main causes liver failure, rickets, renal tubular dysfunction, polyneuropathy. And in the case of acute condition, there will be diarrhea, vomiting, and cabbage like odor. Sometimes death may cause due to the liver failure. Then, what is the treatment? We have to take diets low in triosine, phenylalanine, and methionine. Then, albinism. Albinism is also a inborn error. It is mainly due to the enzyme that is melanin. They also caused by the deficiency or the lack of the enzyme triosinase and decrease in the melanosomes of melanocytes, then polymerization impairment, then protein matrix will be less in melanosomes, then limitation of the triosin, then presence of inhibitors of triosin. Due to these reasons, the albinism will causes. And what are the manifestations? What is the function of melanin? Melanin means it will protect our body from the sun radiation. So lack of melanin in these type of patients will cause skin cancer. Then photophobia, that means the pigment will be less in our eyes. That is called photophobia. Then hypopigmentation. Hypopigmentation means it is also due to the melanin only. So a good example of the hypopigmentation means vertigo, leukoderma. Vertigo means it is a loss of pigmentation around mouth, nose, eyes, nipples, etc. And leukoderma means it is mainly lack of the pigmentation in hands. They will spread. Then graying of the hair. It is also due to this melanin only. Why it is gray means the disappearance of the melanocytes from our hair. Next is 5-hydroxytryptamine and melanin. 5-HT, what it is a neurotransmitter, and this is synthesized from tryptophan. About 1% of tryptophan is converted into serotonin, and this production will take place in target tissues. So we can see the synthesis of the 5-HT. So it starts from tryptophan. Tryptophan will react with tryptophan 5-hydroxylase. In between, oxygen tetrahydrobiopterin is converted into 4-alpha-hydroxy tetrahydrobiopterin. And here we are getting 5-hydroxytryptophan. And this 5-hydroxytryptophan decarboxylate reacting with to form serotonin. In between, hydrogen gives to carbon dioxide. So this serotonin will react with coenzyme to form N-acetyl serotonin with the help of a catalyst, that is serotonin N-acetyl transferase. And this N-acetyl serotonin will react with acetyl serotonin O-methyl transferase to form melatonin. In between, S-adenosyl L-methionine is converted into S-adenosyl L-homocysteine. So this is the synthesis of the 5-HT. Then, what are the functions of this? Serotonin means they are powerful vasoconstrictor. Also, they helps in the regulation of cerebral activity. Then behavioral patterns. Then release of peptide hormones is from GIT. Then mobility of GIT. Then serotonin and brain. Brain itself synthesizes serotonin, means 5-hydroxytryptophan. this serotonin cannot enter our brain directly because of the blood brain barrier. Because sometimes the serotonin's deficiency causes depression. It is a very important stimulator for the brain activity. In psychic patients, the serotonin level will be less. Then, significance of the melatonin. First one is circadian rhythm. In animals, the primary function is regulation of the day and night cycles. Likewise, in humans, during birth or after birth, the melanin levels become regular. It will be about 3 months. Then only this level will be correctly. So the highest level will be measured at the midnight and a morning, that is about 8 a.m. etc. So when our age increases, the melatonin production will decreases. So when children become teenagers means the schedule will be changed. Then antioxidant. Melatonin is a antioxidant. They easily crosses the cell membrane and also blood-brain barrier. And they also helps in the stress, mm, oxidative stress, also helps in oxidative stresses, etc. And they are also effective lipophilic antioxidant. Next is immune system. Immune system means melatonin will react with immune system. And let's see some of the interactions. First one is anti-inflammatory interaction. So it is proved and it is written in many or documented in many other literatures. But in some books they are telling that this is not good. There are many incomplete clinical trials we can see. But in preclinical studies, melatonin can enhances the cytokine production. It is very helpful to fighting the diseases such as viral diseases, HIV, bacterial infections, and for the treatment of the cancer. Then metal chelation. Metal chelation means we are using with complexes with cadmium and other metals. Then biosynthesis of catecholamines. So let's see the synthesis. First one. So we are starting here with phenylalanine and they react with hydrolase. We'll get L-triosine. In between, tetrahydrobiopterin is converted into dihydrobiopterin. So your water is released also. Then L-triosine will react with this hydrolase and they results in L-dopa. So here also same reaction takes places. Then L-dopa will react with decarboxylase and here carboxylation takes places. We will get dopamine. And this dopamine will react with dopamine beta hydroxylase and they will form non-adrenaline. In between, dehydroascorbate converted into ascorbate is converted into dehydroascorbate. Then using methyl transferase, phenyl ethylamine methyl transferase, we will get adrenaline. In between, S-adenosyl methionine get converted into cysteine. So this is the biosynthesis. And what are the significance of catecholamines? Let's see. norepinephrine and ephedrine. They helps in carbohydrate and lipid metabolism. And this catecholamines will stimulate degradation of triacylglycerol and glycogen. They will also increases the BP. Then dopamine and norepinephrine is a neurotransmitters in brain, also in nervous system. Then dopamine and Parkinson diseases. This is a common disorder and it will come above 60 years. And what are the characteristics? Muscle rigidity, tremors, expressionless face, lethargy, involuntary movements, etc. And biochemical basis. Actually, we don't know what is the exact cause of this diseases. Many books are saying that it is due to the decreased production of the dopamine, or it is due to the degeneration of certain parts of brain, etc. Then treatment. Dopa. It is mainly used for the treatment of Parkinson diseases. It is here dopa is decarboxylated to dopamine, and they will lessens the symptoms of this disorder. Then heme. Heme means they consist of ferrous ion. They are a large heterocyclic organic ring. We can call it as porphyrin, made up of four pyrolyl groups, and these groups are joined by the methylene bridges, and they are red pigment in blood. And the major function means the coordination of oxygen molecules in hemoglobin. See, this is the heme. So this is called as porphyrin, made up of four pyrrole groups with methylene bridges. And let's see the synthesis. So here from spleen we are starting. Aged erythrocytes, they are getting into hemoglobin, then to heme. So when converting into heme, other heme proteins is also included in this reaction. Also oxygen is get converted into water, and here ring opening reaction will also takes places. Here ferrous ion and carbon monoxide is reutilized, and finally we are getting biliverdin. So from here the reduction occurs. We will get bilirubin, that is insoluble form, and this will enter into our blood. So we will get bilirubin albumin conjugate while entering the blood. Then when they are entering the liver, we will get bilirubin. This bilirubin will react with 2-UDP glucuronate and form bilirubin diglucuronate, that is excreted. So here we are utilizing 2-UDP. This is the catabolism of our heme. That is formation of the bile pigments. Then hyperbilirubinemia. This is the condition, that is too many bilirubin is present in our blood. So when RBC break down, this substance is produced, that is bilirubin. So bilirubin means it is a pigment, and they'll causes baby skin will be yellowish, eyes and other tissue. This condition we can call it as jaundice. And what are the main causes of this? That is physiological jaundice. That means it is a normal to excrete the bilirubin in the first day of the life. That means while born only. Breast milk jaundice, that is 2% of the babies will develop jaundice after having the breast milk. Mainly, this is caused by the increased reabsorption of bilirubin from the intestinal tract. Then, breastfeeding failure jaundice. It is mainly due to the failure to initiate the breastfeeding. So, this may result in dehydration or decreased urine production, etc. Then, jaundice from hemolysis. It may mainly due to the breakdown of RBC cells and they result in RH diseases to newborn babies. Then, jaundice related to inadequate liver function. That means it is mainly due to the infection or other factors. And what are the symptoms? Symptoms means yellowish color and poor feeding or lethargy, etc. Diagnosis. Diagnosis means RBC counts. Then home test. Home test means blood type and testing RH incompatibility. Treatment. Phototherapy. First treatment is phototherapy. Phototherapy means the bilirubin will absorb the light. So the baby is exposed to spectra light for several hours throughout the day and night. Then fibroptic blanket. This baby is placed under the blanket. Then exchange transfusion to replace the baby's damaged blood with fresh blood. So here the transfusion, that means they will helps to increases the RBC count and they will lower the bilirubin. Then adequate hydration with breast milk or pumped breast milk. That means American Academy of Pediatric, they used to recommend that if possible we should continue our breastfeeding. So breastfeeding babies will receiving the phototherapy which are very dehydrated and excessive weight losses. We can give supplements along with the breast milk. It's nothing, we are giving supplements along with the breast milk. Then treating any underlying causes of hyperbilirubinemia such as infection. So that's for today. Thank you.